Hi, I'm Dr. Rutherford, board certified functional medicine practitioner. This is,
Dr. Randall Gates, I'm a board-certified chiropractic neurologist.
and together we run a practice that is primarily a functional medicine practice that addresses chronic pain, chronic issues, chronic symptoms, chronic conditions of a neurologic and ultimately metabolic nature. Gluten happens to play a significant part in our protocols. We like to share with you what our experiences are in different areas, and the topic that we're going to go over for the next few minutes is being and gluten-free and IBS. And I toyed with the idea of saying IBS is BS, but I thought I might insult a lot of people. But what I'm trying to say is the diagnosis is, as most of you I think probably realize, is a garbage pail diagnosis. That's a term we use in the field, and it means they can't figure out what it is. So there's a lot of different things it can be, goes into the garbage pail, and it's like, okay, it's IBS. Here, take this to control your symptoms. There are a lot of things that go into creating the types of symptoms that have led to your diagnosis of irritable bowel syndrome. And one of them is
gluten.
I was hoping he was going to pick up on that since that was the topic. So yeah, gluten. So
exactly. So basically, IBS.
Yeah.
IBS, as you're saying, is a complex subject. It entails many different things.
It is a very complex subject.
Probably a better term for it is functional gastrointestinal related disorders. That's how it's referred to in the literature by some authors. Functional gastrointestinal related disorders.
I've never heard him say that before.
Well,
functional.
All those hours on my computer.
Exactly. Intestinal related.
Putting all this stuff in my brain. So, anyways,
I'm not sure that might be as bad as IBS.
But anyways,
we know you've heard. I've had it, so I'm not joking. Okay, I had that diagnosis for years and years and years and years and years.
It entails all these different facets that can cause someone to have pain, bloating, distension, diarrhea, constipation, both of those or one of those. And in essence, what we're seeing with IBS patients is that there can be food triggers, so certain foods lots of times will aggravate an IBS patient, like greasy foods, sometimes gluten, sometimes coffee, sometimes alcohol. We can go on and on. Many of you have heard about the FODMAP diet. We also see that in a significant percentage of IBS patients that they have this thing called SIBO. SIBO means small intestinal bacterial overgrowth. And it's a relatively newly acknowledged phenomena. It's another one of those things, kind of like gluten, where it's a hot area of debate in the gastroenterology and nutrition communities, where they have a hard time defining it. How do we really diagnose SIBO? But a lot of the research is coming out of Cedars-Sinai and the doctors down there. That's a well-renowned medical center in the Los Angeles area. Anyway, SIBO is where we can get too many of these bacteria in our intestines. These bacteria can really feed on certain foods that we eat, and they're seeing that the gas produced by these bacteria can cause a person to feel pain and bloating and things of that nature, which you may be experiencing. We're also seeing that
SIBO can be irritated by
certain foods like gluten. And we're also seeing this phenomena of leaky gut syndrome in IBS patients. Leaky gut syndrome is a horrible word, but it's acknowledged in literature, so we're going to go with it. A better word is intestinal hyperpermeability. But it entails where the cells of your intestine should be tightly bound together with like cables, like structures, like the Bay Bridge, so to speak. If you live out here on the West Coast, it's tightly bound together. We're seeing that in IBS patients and some other autoimmune disorders that these intestinal cells can start to open up. And then big proteins from our diet, let's say like a broccoli protein, may leak into your bloodstream, activating your immune system. And that immune activation towards the broccoli protein at the interface where your gastrointestinal tract meets the bloodstream can cause IBS-like symptoms. We also see things like stress, anxiety.
And what are one of the big things that can cause the leaky gut?
Gluten.
Thank you.
Exactly. I was going to wrap that all up.
It's gluten-free and IBS.
I was going to wrap that all up. Exactly. And then also we see things like stress and depression, anxiety can be associated with IBS. Now, where gluten comes to join all those facets is that we're seeing that gluten can cause not only food intolerance reactions specifically itself, we're seeing that gluten can be part of this phenomena of small intestinal bacterial overgrowth, where these bacteria like to eat gluten-rich foods, amongst many other things. We're seeing that gluten can act as a toxin to the little cable-like structures I was talking about that bind your cells together, so then all of a sudden your cells start to open up. It's called a zonulin toxin. We're also seeing that gluten can be associated with depression in and of itself and anxiety. So it's really, really interesting how we have now a vicious
Which can
cycle.
then, by the way, set off a neurological mechanism that can set off too much cortisol and destroy the inside of your gut, which is another thing that can contribute to the diagnosis of, we don't know what it is, called irritable bowel syndrome.
And then also with the anxiety, then it can cause you to become hypersensitive because of the anxiety mechanism. And if you eat a piece of food that's this big, it can feel like it's this big in your intestines. That's been shown as well. And we have a whole topic on IBS on our powerhealthtalk.com. We have many videos on YouTube about SIBO natural treatment, IBS natural treatments. But here, relative to gluten, we need to discuss the study that came out in Forbes magazine a couple weeks ago, as well as many other mainstream news outlets, where they talked about Peter Gibson, who discovered what is termed non-celiac gluten sensitivity. We'll stop there. Non-celiac gluten sensitivity is a diagnosis where basically a person doesn't eat gluten and they feel better. And it started out in terms of a person feeling better in terms of their gastrointestinal symptoms, like IBS. It's now dovetailed into many other things, like depression, like brain fog, like muscle aches, like fibromyalgia-like symptoms, like problems with balance. So he came out with this study in the Journal of Gastroenterology in 2013, where basically he put IBS patients on a low FODMAP diet, which restricts gluten, just so you know. And then he had them eat a diet rich in gluten, a diet mixed with gluten and whey protein, which is from milk, or a diet purely of whey protein. And he found that basically those who ate the gluten and the whey protein together, they felt worse, but those who ate just the gluten or the whey protein by themselves didn't feel dramatically worse.
Relative to their gut.
Relative to their IBS symptoms. And it came out in the literature that he said, I now don't think non-celiac gluten sensitivity exists because it didn't increase these people's IBS symptoms. Well, what wasn't really accurately reported, in our opinion, is that A, these patients were placed on a low FODMAP diet where gluten was restricted amongst many other foods like certain fruits, certain grains, cheeses, things of that nature. And then what was also not reported is that the patients who did eat gluten and whey together, and that has been shown to cause bacterial overgrowth in the intestines, they did feel worse versus just gluten by itself. And it was a relatively small study. I mean, there's 37 people. They didn't eat gluten for that long. There were a lot of potential flaws, in our opinion, relative to that study. Interestingly enough, though, he came out in May of this year and published in Alimentary Pharmacotherapy that gluten does cause depression in non-celiac gluten sensitivity patients, repeating the same experiment. So I think for you IBS patients out there wondering about gluten, know that gluten can be a component of it. Know that gluten can be an underlying cause to this bacterial overgrowth problem, the leaky gut issue, to maybe even your depression and your anxiety. But know that it's far more complex for the IBS or functional gastrointestinal related disorder patient than just gluten or just one thing in and of itself.
Right, it's not just gluten.
And
so if you get off of gluten and you don't feel better, unfortunately, it doesn't necessarily mean that you should go back on eating gluten. Further investigations need to take place if you're mindful of that. But what does it hurt to get off of it? Get off of it for like a month. See how much better you feel. A lot of our patients get off and they feel better in 3 or 4 or 5 days. But I think you should tell people to take like a month, something like that.
And make sure you're eating a well-balanced diet, just so somebody's not out there like starving themselves for a month. But
right, and see if it works. And the bottom line of the whole deal is the testing for it is in such a state of evolution. It is relatively poor. There's a few genetic tests out there and DNA tests out there that are relatively good. They're not cheap. But the bottom line is if you get off of it and your gut feels better, stay off of it. Don't get confused by all of these, different voices in the night. Don't get confused by Dr. Oz getting on television and saying it's a fad, because Dr. Oz doesn't treat anybody. Dr. Oz says what he's been told to say. You know what I'm saying? I know.
I guess we're never going on Dr. Oz.
Well, I guess not. You know what? Because it's okay, because people need to know.
I'm kidding.
Because people need to know, and I can go on and on and on about that too. But the bottom line is give it a try. If you have been diagnosed with irritable bowel syndrome, it means your doctor doesn't know it's causing your gut to be bad. One of the main things that could be affecting many of the things that Dr. Gates talked about is gluten, and you need to be off of it 100% to determine whether it is a factor for you, because you all are going to have, because different people have different sensitivities. I react significantly to gluten. When I eat it, I know I've eaten it in a very, very short period of time. Some people react a little bit less than, a lot less than that. Some people may not really notice it, and so they might, they might think that they can get away with eating gluten like on Saturday night or something. Get off of it for a month, stay off of it, investigate it, don't let any gluten pass your lips. If you feel better, stay off of it, and then know that there's more to look for, because gluten sensitivity is really just the tip of the iceberg for all of these other entities that Dr. Gates talked about. I think that kind of wraps up what I would want you to know about gluten-free, being gluten-free, and relative to your irritable bowel syndrome.
If you have any other questions, go to powerhealthtalk.com. You can also like us on our Power Health Facebook page.
Okay. I'm expecting that Dr. Oz won't be joining our liking group anytime soon. Okay. Nice seeing you. We'll see you again next time.
Thank you.